Welcome, welcome, welcome to this Whole Life Action Hour. I am Ocean Robbins, and I am thrilled you are here with me right now. And I am here with the extraordinary Dr. Mimi Guarneri, and we're going to introduce her in a moment. But first, a little bit of context. Heart disease is the world's #1 killer. In the United States alone, more than 77 million people have high blood pressure, and that is one of the precursors to heart disease. But the truth of the matter is that as widespread as it is, it doesn't have to be your fate. And in this action hour, you're going to find out about the latest research on how you can prevent and even reverse heart disease with simple diet and lifestyle choices. And you're going to learn about the role of relationships and attitude as well as nutrition in optimizing cardiovascular health. Now, I want to be really clear about something here. Nothing you will hear today is medical advice. This is coaching. We're sharing our best insights, but of course, you should always consult a qualified healthcare professional for your medical issues and needs. That said, you're going to learn a lot today. This is a project of Whole Life Club, which is Food Revolution Network's ongoing membership community. Whole Life Club members get lifetime access to all our action hours, including transcripts and the chance to submit questions in advance, as well as weekly recipes, action of the week videos, a community of support, and a lot more. But now we are here with Dr. Mimi Guarneri, and I am so happy to share this time with her. She's board certified in cardiovascular medicine, nuclear cardiology, and integrative holistic medicine. Dr. Guarneri is president of the Academy of Integrative Health and Medicine and a clinical associate professor at University of California, San Diego. She's also the co-founder and medical director of Guarneri Integrative Health Incorporated in La Jolla, California, where she leads a team of experts in conventional, integrative, and natural medicine. She's the author of The Heart Speaks and 108 Pearls to Awaken Your Healing Potential. Dr. Guarneri, welcome, and thank you so much for being with us.
Well, thank you for having me. It's great to be here, especially for Heart Month.
Yes, indeed. And I just absolutely love your work. No pun intended there. I think it is so critically important because our hearts, you know, we think of the heart as a muscle, and then we think of the heart as that thing on Valentine's Day. It's our love. And you're bringing the two together. You're showing that actually there's a reason why our physical heart and our emotional heart have the same name. Can you tell us what that reason is? How do you see that?
Well, it's kind of funny coming from a cardiologist, but when I wrote my first book, The Heart Speaks, it was really about looking at the heart not only as a physical pump, but as an emotional heart, a mental heart, and a spiritual heart, because it's all of those. And we all know that people who have emotional upset, especially today, we call it Takotsubo cardiomyopathy, big fancy term for broken heart. Yes. We know stress affects the heart and depression, and even the American Medical Association just did a publication this week on loneliness and the impact it has on health. So it's not just a physical pump.
Yeah, absolutely. So just a little bit of background, because you came up through the, I'll call it the conventional mechanistic view of heart health. And then your practice has evolved to combine the best, really, of all different worlds, looking at what actually helps people, which sometimes includes the latest advances of Western medicine, and sometimes it doesn't. How did that journey evolve for you?
Well, I started in the cardiac cath lab, and I was putting in over 700 stents a year, very mechanistic, about as mechanistic as you can get. And then I met Dean Ornish, who many people know. And Dean was doing research at that time on yoga and meditation and nutrition and exercise, group support. And he said, would I be willing to be the principal investigator of the Southern California network for that research? And I said, okay, let's do it. And what was eye-opening to me as a cardiologist is I had the sickest people in our Ornish program. These were people who could not have a stent or were too sick for a bypass at the time. You have to remember, this is the 1990s. And I saw transformation after transformation, people decreasing their weight, people improving their energy, lowering their cholesterol, lowering their blood sugar. So all of these things open my eyes to the fact that lifestyle change is key to preventing and reversing disease, not just heart disease, but we're also talking about things like kidney disease, cognitive decline. All of these things can be completely reversed.
Yeah, fascinating. We have a lot of questions from our members and community, and so I just want to jump right in, and I'll ask if you can aim to keep your answers as short as you reasonably can so we can get to as many as we can. And I'm just going to go through these in no particular order because that's how they came to us. So Luella said, can I still have a healthy heart when I live with a primary relationship that is characterized by estrangement and dysfunction? How can I mentally and emotionally frame this reality so I can optimize my health, happiness, and availability to restore the relationship when reciprocity arrives?
If Luella wants to remain in this relationship, then she needs to take care of herself. She needs to put a program into place that takes care of her physically, emotionally, and mentally. And that may include removing herself when the situation is stressful. It may include bringing in practices like yoga and meditation, walking in nature, so that she can take care of herself. And that's the key here. The only person you can change is yourself, not someone else. So Luella has to love herself enough to take care of herself and to put a program into place so that if she chooses to remain in a toxic environment, that she has her protective mechanisms in place.
Thank you. Another one came in from Mary who said, I have familial high cholesterol and my cardiologist is not happy with my decision to not take statins. Eating a primarily plant-based diet. Is coconut oil and coconut milk, which are saturated fat, not a good thing to consume? Any non-statin recommendations? Keto diet does not seem to be the correct diet for me. Your thoughts, please.
I like the plant-based diet. It's my favorite diet. It's high in fiber, it's high in nutrients, and it has no cholesterol. I would eliminate the coconut oil. The coconut milk, unsweetened, is not so much of an issue, but the coconut oil is a saturated fat and in some people will raise cholesterol. I suggest adding fiber, lots of fiber to the diet, even in the form of a soluble fiber. And there are many things we can do on the natural side to improve cholesterol.
All righty. Thank you. Sylvan asked, what can help the irreversible condition of valvular heart disease besides a whole food, plant-based diet?
Hi, Sylvan. Valvular heart disease, it depends on if it's a leaky valve or if it's a tight valve. This is usually a mechanical problem. If it's a leaky valve in particular, the best thing you can do is keep your blood pressure nice and controlled and nicely low. That means a less than 1,500 milligrams salt or sodium based diet, but it really depends on the details of the valvular problem. At the end of the day, plant-based diet for your arteries and to prevent further calcification on your valves is the best way to go.
Thank you. Helen asked, are there any dietary or lifestyle modifications that can be made, such as foods or activities, to add or subtract to eliminate heart arrhythmia and to raise a low heart rate, 32 beats per minute? And can fibrosis caused by myocarditis be reversed or improved by dietary or lifestyle changes?
These are two very complicated questions. If the heart rate is really 32 beats a minute, and it's a regular rhythm, and someone has worn a heart monitor to show that there's no long periods where there's no heartbeat, and they can go on a treadmill, and if their heart rate increases appropriately, we don't worry too much about that. But if someone is having a low heart rate and dizziness and lightheadedness, obviously we have more concerns. The fibrosis part is also a very difficult one, but if it's leading to high blood pressure, then a low sodium plant-based diet, daily walking program for everything is the way to go.
Thank you so much. Gina said, Dr. Guarneri, thank you for your amazing work. Can atrial fibrillation be reversed? My husband's doctor tried to reset it through a procedure using the paddles, but it did not reset his heart. Also, do caffeine or highly caffeinated drinks affect atrial fibrillation in any way or even cause it? Thank you from the bottom of my heart, no pun intended, she said.
Okay, Gina, this is really quick, but this is what we need to know. The first thing is they need to check your husband for sleep apnea. Sleep apnea is frequently missed and is linked to atrial fibrillation. Second, we need to know that his potassium level is above 4, somewhere between 4 and 5, and that he's getting plenty of magnesium, and he's staying hydrated, and his blood pressure is controlled. So we can really do a lot for atrial fibrillation, but what I see missed all the time is sleep apnea. So make sure he gets checked for that.
Thank you. And by the way, I said this at the beginning, I'll say it again now, none of this is medical advice, because obviously, if you're going for medical advice, you need to work with a qualified professional who knows your specific case and has the time to really spend with you. This is coaching and just sharing best insights, and that's the context for all of it.
And thank you for saying that, because I'm getting just one small snapshot, and and we can't treat with one small snapshot.
Exactly. So take it in context with a no sodium grain of salt, perhaps.
No sodium, low sodium is good for all of us. Yeah. Green leafy vegetables are good for all of us, right?
That's right. Regardless of the condition, that's pretty much always going to be one of the prescriptions. Karen said, what would be the root cause of high blood pressure when you eat right most of the time, exercise, meditate, and sleep well? I'm 45 and the doctors say it runs in the family, but I don't want to get on the blood pressure medication. Where should I start to look? Are there any particular tests I should consider? And how do you go about the emotional part of the healing process? i.e., how do you discover what the underlying emotional traumas are? Thanks so much.
That great question. Thank you. So the first thing is, again, going back to our less than 1,500 milligram sodium diet, getting to the ideal body weight, walking every day, literally exercise a minimum of 10,000 steps. And then we need to look at the stress side of the equation. Transcendental meditation has significant reductions in blood pressure. This is evidence-based research to support that. So you may want to learn transcendental meditation. You may want to get checked also for sleep apnea, because it's a frequently missed cause of high blood pressure. And if you're under a lot of stress, serum cortisol will raise your blood pressure. So really looking at the stress response. Now the other piece, if you are eating black jelly beans or black licorice, if you are someone who has a licorice addiction, which many people do, particularly black licorice, that can raise blood pressure. So take a look at your supplements and make sure there's no black licorice in there.
All righty, thank you. Deborah asked, what do you eat in a typical day, and which supplements to supplement your food do you take, such as vitamins, minerals, antioxidants, etc.?
Thank you for the question. My diet is plant-based. On a very, very rare occasion, I will eat a little bit of wild salmon, but that is a rare occasion, especially with the current supply. I take a multivitamin, a good high-quality multivitamin. I take B vitamins because of my plant-based diet. I do use omega-3. I think it's really important for the brain. And vitamin D. Vitamin D is critically important. So I call these the sort of foundational supplements. And you can draw your blood and look at what you need.
Yeah, thank you. And myself, the supplements, the sort of core 3 that I take every day are going to be omega-3s, EPA and DHA specifically, as well as B12, since I'm on a plant-based diet. And even 22% of omnivores are deficient in B12. Especially as we get older, we don't process it as efficiently. And then also vitamin D3, unless I'm getting a lot of sun exposure on a given day. Thanks so much for that. Cynthia said, what do you consider to be a high cholesterol number? If drugs are recommended to bring a number down, which one, in your opinion, is the best with the least side effects? Obviously, we're not getting into medical advice here, but any thoughts from Cynthia?
Hi, Cynthia. It's not an absolute number. What I would suggest, instead of just looking at your total cholesterol or even your LDL, what we say is the so-called lousy cholesterol, I really want you to look at your LDLP particle number. How many LDL particles do you have? Because if that is greater than 1,000, then getting off the sugars, simple sugars, carbohydrate, exercising every day, losing weight will bring that number down. That's the most important number, more important than LDL. And also for women, look at your inflammation marker, your HSCRP. This really is going to determine a big piece of your cardiovascular risk. So not so simple as just total cholesterol. And if you look at my book, 108 Pearls, if you really want to learn about this, I completely lay that out for you so you can understand it.
Great, thank you. Allison said, I'm receiving mixed messages about soy products. I've been using soy milk from whole soybeans and tofu for a long time, about 30 years. Should I be concerned? How much is okay?
So based on the Japanese data, we don't think you should be concerned. Japanese have very low incidence of breast cancer, for example. I would suggest your soy be pure, like organic miso, organic tofu, not processed. And of course, the more it looks like a hot dog or the more it looks like bologna, the more processed it is. So we like to stick with the more natural forms of soy and get them organic.
Yeah, and a quick little plug for my favorite personal brand of soy milk. Eden Soy makes an unsweetened soy milk that is just soybeans and water, organically grown. And they put real soybeans in there. There's 12 grams of soy protein per cup, and it's minimally processed for a soy milk. I mean, obviously all soy milk is processed to some extent, but if you're gonna go for a soy milk, I think that's a pretty good option personally. It's what I have in my unsweetened coffee in the morning.
I agree with that.
Yeah, we heard from Sherry who said, what is your opinion on Lunesta? I noticed mild to severe palpitations throughout the day, which was alarming to me with my heart. Is there a better solution?
Well, Lunesta is a sleeping pill. So the question is, why are you not sleeping? And usually it doesn't cause palpitations. Palpitations usually come from not getting enough magnesium, potassium, and staying hydrated. So first question for me is always, why are you not sleeping? Are you exercising during the day so you get tired at night? Making sure you don't have sleep apnea? Making sure you're not looking at the computer screen late at night or the TV and then trying to fall asleep. I prefer much more natural sleep aids like sustained release melatonin, again, not prescribing, but we really don't like when people are taking sleeping pills every night if we can avoid it.
Yes, thank you for that. I recently decided to take sleep more seriously. I had always kind of taken it for granted, and I realized I'm hearing so much research on the quality of sleep and the importance of it. So I'll share a few of the things that I did personally to try to enhance it. And I will say I am getting more and better sleep now than I was noticeably. So one thing is that I stopped being on the computer in the evening, except in rare occasions. And then I actually have blue light blocking glasses that I can use. I try to cut it off at 6 p.m., you know, and that's not easy for me. If I want to work a really long day, I have to start early. That's my new rule with myself. And I realize I'm better off, frankly, this may sound extreme, but I'm better off starting the workday at 5 a.m. than working till 11 p.m. if I'm given the choice, right? So that my biorhythms are more synced with nature. And then I also started dancing and moving in the morning. So I try to get up and actually really get going rather than kind of being in a fog. So once I get going, I've been dancing at dawn every morning for the last 6 weeks. It's been so fun. And I often take a shower in the morning too, but I really want to like get moving and have my body have a clear distinction. Now it is morning and I'm rolling, and it feels like my biorhythms are getting synced now, and I actually get really tired at bedtime. And it's been nice. I'm sleeping deeper and better and more consistently every night. And there's a thing to that biorhythm. It takes a little time to nail it, but I'm really happy that I'm in that rhythm right now. So I just wanted to celebrate that. And that's because of interviews like this, where people like you are talking about it. And I realize, oh my gosh, this applies to me too. So,
and I want to add one thing. Don't eat dark chocolate and cocoa and cookies and things, sugar that are going to keep you up all night, and alcohol too. So I agree with you 100%.
And better yet, don't eat anything after, 6 or 7 p.m. or, give your body some time so you go to sleep on a slightly empty stomach. That's the best for your biorhythms. Then your body can focus on sleeping instead of digesting, which will, because it actually takes a lot of energy to digest. And your brain can't totally turn off if your stomach's active and busy with a lot of work.
Agreed.
We heard from Audrey, who said, what is your advice about eating leafy greens and drinking herbal teas like hibiscus while on medications for heart disease?
I think eating leafy greens is one of the best things you can do. There's only one drug that leafy greens interferes with, which is warfarin or Coumadin. For people that are on that medication, I recommend a stable dose of leafy greens every day, meaning you don't eat tons one day and none the next day, and you monitor your blood thinner. But leafy greens are filled with calcium, magnesium, fiber, best thing that you can do. Hibiscus and herbal teas are quite good for you and anti-inflammatory.
Thank you. Barbara said, I previously had high blood pressure and still occasionally have spikes. My doctor, who's also plant-based, indicates that certain norms are not the same for a plant-based person, especially when our other numbers, cholesterol, A1C, triglycerides, etc., are so much better than the average person. Can you explain what numbers are critical and which norms are different for whole foods, plant-based versus standard American diet patients?
I agree that the people on the standard American diet have many more health challenges. They're obese, they're diabetic, they have heart disease, and so on, and all the problems that go with that. However, we do know that blood pressure should be 120/80. If it spikes, the question is, why is it spiking? Usually that's related to emotions and stress. There are some wonderful breathing programs that can be done to teach you how to control your autonomic nervous system so you can keep your blood pressure low. I don't necessarily agree to let, just because someone is vegan or vegetarian, that they should be running around with a high blood pressure. I don't think that that's a good plan.
Yeah, okay, thank you for that. Pat said, I was told I had a 70% blockage in the carotid artery with a 50% blockage on the other one. I immediately started Dr. Esselstyn's Plant Perfect diet. I've been on it for 7 weeks now. I've just started attending exercise rehabilitation. I'm not on any medications as I refused statins. Number one, is it reasonable to expect clear arteries? Number two, approximately how long will it take before it will provide my non-believing cardiologist evidence that it's working? And number three, is there anything else I should be doing?
There's definitely things you can be doing, and I agree with the diet. I think it's a good diet. I would also look at Ornish's book, because Ornish has the research that has shown to reverse heart disease. You have to look at your emotional status. Are we dealing with stress? Because if we're not dealing with the stress piece, you need to get into a yoga meditation class, learn transcendental meditation, centering prayer, whatever speaks to you from your perspective. So the physical piece, you always have to say, what did I do for body, mind, and spirit? The physical piece is the diet, the exercise, getting to your ideal body weight, and so on. And yes, you can reverse this process, but the numbers have to be perfect. The blood pressure has to be perfect, and the markers for inflammation have to be perfect. And this is something we do every day in our practice. So it's doable, and find a cardiologist to help you instead of tell you that you can't do it.
Yes, thank you for that. Laverne asked, how important is the CT calcium scan and what age should someone have it done?
Calcium scan is really important because we now know that as people's calcium score goes up, so does the risk of cardiovascular disease. It depends on your family history. It is radiation, so we don't like to do it all the time. We have easier ways to look for calcification in arteries. For example, we can look at the carotid artery with an ultrasound. We can look at the thickness of the lining, and we can look for plaque in the artery, and that requires no radiation. Coronary calcium score does provide valuable information. I would say if you have early menopause for a woman or right at the time of menopause, it's nice to have a baseline. If you're the kind of person, when I have a patient say, well, my cholesterol's high, but I don't want medication, I don't want supplements, I say, let's do a coronary calcium score, because if it's 0, your risk of a cardiovascular event is extremely low. If it's high, as the calcium score goes up, the risk goes up. So again, personalize it, individualize it.
Thank you. My goodness, we have a lot of questions. I keep seeing more. You're doing an amazing job being succinct and so thoughtful. And I just want to say how much I appreciate your decades of thoughtful research and practice and your willingness to share your wisdom with us right now. We have a question from Chris who said, thank you for your wonderful contributions. I'm a woman in my mid-60s on a primarily plant-based diet with osteoporosis. I've read there's a link between this and coronary heart disease. Are there recommendations you would make to address osteoporosis outside of weight-bearing exercise?
Absolutely. We need to get your vitamin D level up. I like it to be up to 55. I'm going to recommend a book for you by Laura Pizzorno. It's called Your Bones. It's very thoughtful and I think well written, and I recommend it for my patients. But certainly exercise, the nutrients for the bones, which go way beyond calcium, lots of green leafy vegetables, and also strength training. Looking at hormones. All of these things are important for the bones. So take a look at Laura Pizzorno's book. I think it will help you.
Great, thank you. We heard from Lori, who said, I was diagnosed with AFib. I turned to a mostly plant-based diet, quit coffee, I work out every day. My symptoms have diminished. I'm now on only 81 milligrams of aspirin. I now feel it about once every 1.5 months for an hour. I'm not sure what that means, actually. I think that must be a typo. I recently read that NSAIDs could bring on heart palpitations. Is this true? If so, what would be another option? I was on warfarin, but have gotten off.
Okay, so atrial fibrillation can come and go. Again, whether you need a blood thinner depends on what we call your risk, your age, whether you have a history of high blood pressure. This is something you must discuss with your physician. Make sure sleep apnea, again, isn't involved. That can cause AFib. Make sure you stay hydrated. Many women get dehydrated. Make sure if your kidneys are normal, you're getting magnesium. So there are lots of things that we can do for atrial fibrillation, but I would stay away from stimulants, over-the-counter cold medicines that have Sudafed, for example, too much caffeine, espresso, dark chocolate, and sugar. Sugar is a trigger for atrial fibrillation, as is stress.
All right, thank you. Catherine said, I've lived a life focusing on the outside. I'm learning to go deeper inside. I also have difficulty receiving. I tend to prefer giving. What can I do to bring the flow in and out together and create more relaxation, peace, and harmony?
Well, that's a beautiful question. And the first thing I say to all the women is you have to learn to love yourself. And you have to remember that when you're on an airplane and they say the oxygen mask falls, they say, put it on yourself first. And women tend to be caregivers. So you have to learn to love yourself, and you have to think about, what do I want to do that brings me joy and that I can do to take care of myself? Just from the description of that question, I think being in a yoga community, a spiritual community, really connecting with people of like mind would be a great place to start.
Thank you. Marcia said, my husband is in denial about how positive plant-based is. He is diabetic. Any tricks to wake him up?
Well, we always say denial is not a river in Egypt. We see it all the time. You know, if he needs to decrease his weight, just get him off the sugar and carbs, get him on more and more vegetables, and use his animal products as what I call transition foods. You can slowly wean him off. He probably won't even notice. But if it's diabetes that's the issue, then getting him off the sugar and carbs is the first big step, and really upping his vegetable intake, his fiber intake, and getting him moving and walking. And as he starts to feel better, this is what we learned with all our research in the 90s with Ornish, feeling good is a motivator. Worrying about having a heart attack is not a motivator for most people, but feeling good, looking good, that really starts to motivate people, having a reason to do it. And if someone doesn't have a reason, or they're not motivated, then we have to really look at, are they depressed, right? What's going on here?
Yeah. I sometimes think that pain pushes and vision pulls. And for some people, we're motivated by a fear of death or suffering. But a lot of people are motivated by vision of what they want for their lives. And sometimes it's a combination of the two. The beauty of a whole foods, plant-based diet and exercise and positive, healthy, loving relationships and stress reduction is that these all create more positive feelings and good feelings in the body, which over time creates a positive feedback loop. The truth is that it's a lot easier to make good decisions when you feel good. And so
Exactly.
we want to create the conditions that optimize that. But sometimes starting from a tough spot is tough. And it's just one foot in front of the other. Sometimes it takes doing the right thing even when you don't feel like it in order to get some momentum built. And then eventually it does get easier. You do start to feel like it.
Right. And many people forget how good they can feel, right?
Yeah.
So.
Yeah. Karen asked, what strategies, in your opinion, are the most top-notch of importance to initiate, and in what order to recover your heart health after a heart attack? Like number 1, number 2, and number 3.
Let's do them body, mind, and spirit. Let's make sure you are on a plant-based diet. And let's make sure you are going out every day and spending a little time in nature. Even if you're walking half a block, slow and steady, let's make sure you're doing some sort of physical activity. And then let's look at where you're at from an emotional perspective. If you're depressed, if you're stressed, if you're in an unhealthy relationship, we really need to look at that. What caused you to have this heart attack in the first place? What's going on in your life? And that's fundamentally important. So every day, just say, what did I do for body, mind, and spirit? Did I sleep? Did I eat my plant-based diet? Did I take my walk? Did I do my journaling or practice my yoga or my meditation? What am I doing to heal my body? And I want you to remember, your body is your temple. Only you can make those changes, and you have to find a team that works with you and supports you in the process.
Thank you. Becca said, the heart is a muscle. So my question is, after years of damage, can it heal?
It depends on what the cause of the damage is. If somebody has a weak heart muscle from a virus, for example, or from broken heart syndrome, we can heal the heart many times with proper nutrients, medications, supplements like CoQ10, fundamentally important, evidence-based for helping to heal the heart. But it really depends on the etiology, as we say. And if it's not big heart damage, you can go on and live a good, healthy life. It's just a matter of staying healthy for the journey. So that's a little bit more of a personalized question.
Yes, thank you. We had a question from Julie who said, how can someone who eats the standard American diet or the keto diet get a heart scan showing 0 blockage?
Well,
I had 2 people tell me this was their results. They're both in their 40s.
Right, so they're both in their 40s, so it's kind of young yet to have heart scans showing blockage. I mean, 40s is still fairly young, especially for someone who's not diabetic and not smoking cigarettes. So I would encourage that person to, I'm not a fan of the keto diet. I like aspects of it. I like not eating simple carbs. I like people not eating sugar. But at the same time, I don't like people using gravy as a beverage. I really think that that is not sustainable. So, and we don't really have evidence to support that it's good for the heart, as much as people still continue to do it. Now, my feeling is this person has to have some more time, but the keto diet to me is not sustainable. Get those vegetables in, keep the sugar and simple carbs out, and you're going to live longer based on the research.
All righty. Thank you so much for that. Let's see. We have one from Suni. My husband is 82 years old. He's had triple bypass surgery 28 years ago, 10 stents and ablation 2 years ago, and is on Coumadin. Is it realistic for us to get off prescription meds if adhering strictly to a whole food plant-based diet?
All right, so let me just say this. Prescription meds aren't always evil. There's a time and place for everything. Yeah. So it shouldn't be one or the other. That's why I call my practice integrative cardiology. There's a time for bypass, there may be a time for stents, and there may be a time for medication. There is always a time for plant-based diet. There is always a time for fitness and joy and dancing and finding your purpose in life. So I always feel that you can lower your medication needs by doing more with your lifestyle. And and that should be your goal. How can I be on less medicine by doing more with my lifestyle and working with a clinician that helps you to do that? That to me is what's fundamentally important. And the only time we use Coumadin today, warfarin, is if somebody has an artificial heart valve. I just want to say this: for atrial fibrillation, we have other medications on the market that we use. We don't really use warfarin.
Yeah, got it. Thank you. I know we're almost out of time for your schedule today. One last question. Cindy said, I have AFib. I wonder if diet has ever been able to help reverse this condition.
Absolutely. I've seen it in my practice. AFib usually comes from caffeine, stress, sleep apnea, too much dark chocolate, too much sugar. There's usually an underlying reason for it, and we have to get to the underlying cause. And I just want to say, since it seems like a lot of these questions are from women, and women, of course, caring for the men they love, that at the end of April, we're doing a women's retreat here in La Jolla called Sarah's Heart. And it's the weekend of April 24th. And we'd love to have everyone come out for 2 days of really women coming together to share these kinds of questions and put together programs for their life.
Wonderful. Okay, so if people want to find out more about that, what do they Google?
Right now, they can go to my website, which is Pacific Pearl La Jolla, or they can just call the office at 858-459-6919. We'd love to have a nice group of women come together, and the space is limited, but we'll do it again. So
okay,
thank you.
And you can go to Sarah's Heart. You can Google Sarah's Heart Mimi, and it'll pop right up as well. So that works too.
I hope so.
Yeah, I just checked it. It works.
Did you check it? Oh, you're fast. Okay.
I did. Yeah, absolutely. Okay. And everyone watching Mimi's amazing books, The Heart Speaks and 108 Pearls to Awaken Your Healing Potential, are fabulous. Mimi, I'm so grateful to you. Thank you so much for joining us.
Thank you.
For your
my pleasure.
Exquisite, brilliant insights. We're so grateful.
Thank you.
All righty. I'm going to let Dr. Guarneri go now, and I'll just say a couple more words since we didn't get to all the questions. I wanted to address a couple more. Again, thank you, Dr. Guarneri. You can drop off if you like. We won't have time to get to all of them, but Joan said, I live in New Hampshire. I'm looking for a plant-based integrative doctor. How can I find one, and what should I look for in order to find someone who is qualified? Well, I do want to make sure you are aware of a couple of resources. There is plantbaseddocs.com. Again, that's plantbaseddocs.com. And then there's also plantbaseddoctors.org. And those are both websites of directories of plant-based doctors around the world who are interested to some extent in holistic lifestyle-based medicine with a plant-based friendly approach. And there's no guarantee, of course, that any one of those is necessarily going to be the right fit for you, but you will find people who at least say that that's a value or an interest of their practice, which is a big head start over most of the doctors you'll find in the world. And it's not just MDs, by the way. They have resources of health professionals from various modalities, although a lot of them are MDs. So those are a couple of resources you may find useful. As far as how to find out whether someone is a good fit for you, that's a very personal choice. You have to see if you trust them, if you feel that they get you. You know, are they just checking off forms, or are they actually in connection? Do they have a track record? What are their reviews like? I mean, do you know anybody who's worked with them? These are all factors to consider, of course. Ultimately, you have to use your own best judgment. Finding a health professional you trust is a wonderful thing when you find somebody who gets you and who is able to really be of ongoing support as a resource. And usually they're part of a team. They're not the one person who does everything. So hopefully that's of some value. And if you had a question we didn't get to, we got a lot of questions coming in for this one. Please feel free to raise them in our ongoing support community of Whole Life Club if you're a member. For everybody else who's joining us, please check it out. Whole Life Club is an incredible resource, and we're doing great things together, building up our welcoming, healthy, organic lifestyle empowerment community for our whole lives. Everybody with us, thank you so much for your time, for your attention, for your interest, for your curiosity, for your participation in this food revolution. Your heart is precious, your heart is sacred, your heart is beautiful. Take care of it. Eat well, love more, move more, stress less. and reap the benefits. Blessings on your day, and thank you so much for joining us. This is Ocean Robbins signing off from this Whole Life Action Hour and wishing you a beautiful day. When it comes to cancer, Alzheimer's, diabetes, heart disease, and other chronic illness, what really matters isn't how many books you read, how many webinars you attend, or how much you know. What really matters at the end of the day is what you eat and how you live. The science has given us what we need to know. Now it's time for action. It's time to implement and optimize your healthy lifestyle. It's time to get results. It's time to say goodbye to confusion and hello to clarity. It's time to say goodbye to bad habits and hello to good ones. It's time to fall in love with foods that love you back. It's time to join a community that will support you in achieving your goals. It's time for Whole Life Club. Click the link to find out more and to join in now.